Welcome to the part 2 of the nursing webinar series on home care. The objectives for this webinar are to learn more about the opportunities in home care, learn about potential partnerships with agencies, and then learn how the Minnesota Home Care Association members may be a resource for your nursing programs. When you're looking at home care nursing, in the previous webinar, we talked about the assessments, the one-to-one, and so where does this fit into that care continuum? In the light of COVID-19, it is even more critical because everyone wants to reduce the exposure of very ill patients to the outside world, if you will. So in this webinar, we're showcasing different nursing opportunities within home care and the development the environment inspires. We would like to elevate home care as a career track that will attract more nurses to this very high level of care and even critical care. So we are looking at what we can do as home care providers to collaborate with you and hopefully be able to establish clinical sites to support you and site rotations for your students. Home care, a good fit for new grads. You don't always hear that, and that's one of the myths that we would like to dispel. And it's interesting, we looked at the history of home care, and what was appealing to the home care nurse 30 years ago continues to be the same. May not have the old technology in the past, but the goal still is observing and caring for clients in their environment and making changes appropriately. It is very comprehensive and it's an ongoing relationship that becomes very meaningful. It is teaching the clients along with their families in their own environment. It allows you to travel the countryside and even get reimbursed for your mileage. It gives you a lot of autonomy because you are the one in charge. There's a team approach, and so many of the times you may end up working close to home because they divide the care that way. It is an opportunity to really develop wonderful assessment skills. There's an opportunity to partner with the therapist and look at the reimbursement for Medicare clients. And then finally, there is the opportunity to develop many new nursing skills, such as the vacuum assisted closure, IVs, venipuncture, pleuric systems, and on and on. There are many career pathways and opportunities in home health care. And some of these include skilled nursing visits, extended hour skilled care, care planning, quality assurance and compliance, intake specialist, nurse education. And we have a slide in a video in the next slide that does see a home care educator nurse share the diverse opportunities in home health care. So this link, you cannot help but sense the passion that this nurse educator has. And so we will watch as she relates what she does in her role.
If I had an opportunity to talk to one of your nursing students, I would tell them to seriously consider home care as a rewarding career path. There is such a huge variety of opportunities with careers when it comes to home care. It could be short, episodic, skilled nursing visits where it's going in for 6, 8, 12 weeks with that patient and their family members, teaching them things like medication management, things like being able to assess and transition to feeding regimes. There's just a lot of different things with the skilled nursing part of it. There's also extended hour nursing where you're in the home with that family for 8 to 12 hours a day, but you are also on the cutting edge with them, bringing them home from the hospital, teaching them all that they need to be taught in the home care setting. And you're the liaison between the rest of the healthcare team, communicating on a regular basis with the family, the patient, and the healthcare team, managing all the complexities that come with that, from just the regular particular physical needs to medication management, to occupational therapy, physical therapy, speech therapy. You are an integral part of, if they are in school, working with their school district and making sure that their IEPs are in place. If it's someone that's older in their, in the elderly population, for instance, you may be dealing with palliative care teams, end-of-life issues, hospice teams. So there's just an incredible amount of opportunity. The other thing with it is it's just not skilled nursing visits, and it's just not extended hour nursing, but there are other educational needs that may occur where you may become involved as an educator. You are teaching the nurses that are going out into the home care industry. You are teaching them how they're going to do this. You're providing them with the tools that they need. You are also educating broadly. You may create online classes. You may end up providing education to community members such as paramedics, EMTs, your EMS responders. There's a huge variety that you may be doing. There's other things that you can do, such as infusion nursing. As a home care nurse, you are a lifeline for your patient and their family. If I could leave you with one thing, it would be to make sure that your students have exposure to home care, to know exactly what it is. It is empowering, it's autonomous, and it is life-changing.
What is home care nursing? We all have a basic understanding. Home care nursing provides care based on an assessment of a client's medical or healthcare needs that can be carried out in the home. This care includes ongoing professional nursing observation, monitoring, intervention, and evaluation. This level of care provides continuity, intensity, and the length of time required to maintain or restore optimal health and provide hospital level of care so clients can remain in their home environment. How does home care fit into the care continuum? Home care fits in the care continuum in various capacities through skilled nursing visits, home infusion therapies, skilled hourly nursing services to work with the care team to coordinate care, provide and ensure continuity of care, promote compliance, to be effective and efficient with healthcare dollars, services, and care. Home care today has the goal of being the continuous thread that remains consistent throughout the client's care continuum. Home care provides collaborative outcomes-based care. As you were shown by the previous testimony by the nurse educator. The home care model today, the expectation of a home care organization are to provide client-centered care. Demands for client-centered care are on the rise, as many organizations are looking to decrease the amount of time a client spends in an inpatient setting. Home care is often the solution. While home care is often less expensive than alternative inpatient settings, it also has the added benefit of the client learning and healing in their own environment. The main purpose of home care is to assist the client to remain safely in their home. This is done through education to the client and caregivers. To promote high quality outcomes, licensed clinicians must be well-trained and skill-focused. This high quality client-centered care reduces hospitalizations by maintaining and optimizing health by providing quality, skilled in-home health care. Training programs for staff are based off of state requirements as well as company policies. Home care agencies are to determine what constitutes an appropriate orientation. Oftentimes, an orientation period in home care consists of the new staff being assigned to a precepting staff member. Thorough checklists of skills are gone through, as are policies and procedures to meet educational requirements and develop staff who are knowledgeable of patients' needs and the resources to meet them. Nurses in home care can often expect to have more one-on-one time with their clients than in most other settings, often finding themselves in an expanded role, acting as not only a caregiver, but also an educator. Nurses will need to work on building the client's trust in order to have the best interactions and outcomes for each client. Nurses can often expect long but satisfying days. Home care positions offer autonomy and flexibility, which is not easily matched in many other nursing positions. Home care staff often stand out in the field as a clinician with a vast amount of knowledge and independence and skills. This is evidenced by their ability to adapt in the client's home outside of a typical medical setting. Outcomes are publicly reported and agencies are graded based upon them. Clients and caregivers are able to choose which provider they prefer to use for the healthcare needs based on these outcomes. As many organizations are looking to decrease the amount of time a client spends in an inpatient setting, home care is frequently a chosen alternative. Measured outcomes prove that home care is an effective way to improve a client's ability to manage their activities of daily living and instrumental activities of daily living needs. Home care has been adapting through the pandemic to support healthcare symptoms by providing testing, immunizations, and caring for COVID-19 patients to reduce hospital stays, opening up much needed hospital resources. Also, we have robust training and mentoring. New graduates' home care's training standards are very high and have a progressive approach. Prior to any patient interactions, new grads complete approximately 16 to 24 hours of classroom training, in addition to self-directed learning modules, and also include approximately 8 to 12 hours of hands-on or simulator training. Then they progress to in-home training, one-on-one with a trainer for about 40 hours that is focusing on the client's specific needs. And then mentors are trained to guide a new graduate through each step of the client-centered model so that there are feedback to promote growth and also an additional progressive approach. They focus on clinical aptitude, time management, emotional intelligence, boundaries, emergency protocols, and much more. A successful home care nurse can transition easily into a high demanding facility-based setting, taking with them skills that mirror an ICU level of care. Increasing the number of nurses serving clients in their home is important for the future of home care. Minnesota Home Care Association is interested in partnering with the nursing programs across the state to meet the needs of our communities. In addition to creating an awareness of opportunities in home care, we believe that together we can inspire nurses, invest in new learners, share knowledge that is imperative for all involved. Healthcare is ever-changing. We believe that developing a relationship along the way will share a valuable perspective. How can Minnesota Home Care Association members support your nursing programs? Increase awareness of home care as a career choice. Present on the topic to your students, either in person or virtually. Be a resource at a career fair. Help with mock interviewing. Career shadowing, mentoring programs, and new graduate programs. Sim partnerships, and help in creating scenarios for you to use in your own programs. Thank you for your time and consideration. On behalf of the members of the Minnesota Home Care Association, I thank you. We look to invest in the future of nursing. Let's work together to ensure nurses are prepared for the changing roles in nursing. Let's increase awareness of the many opportunities within home care. Utilize Minnesota Home Care Association members as a robust resource.
In conclusion, I'd like to highlight some of the things that the Minnesota Healthcare Association would like to do to continue this dialogue. Look at the scope of need within your own community. Can we look at implementing partnerships or processes with your students? Can we prepare to become a part of your curriculum? As you heard previously from the one testimony, the nurse who chose home care had not had any exposure until she actually went to a career fair to decide on that specialty. So we would like your feedback about when you would like to start, what is the best timing for you, and what is your time commitment so we can help you and your resources. Finally, please recognize that the Minnesota Healthcare Association is a resource for you. We want to increase this enhanced partnership, and we would like you to respond to the survey at the end of this webinar. Thank you.